Good evening to everyone and welcome to today's historical session with Dr. Murli Bharadwaj, where we are entering into the 2020. Once upon a time it was all unheard that midnight 11 o'clock the teachers can and the students can ever meet. But today with the YouTube, live online, you sitting at your home, we sitting at our home, we can be able to prepare together. So, Alec is asking, why historical? I still remember first time when I started the coaching program, that was 1999 in December. And where are we now? We are in 2019 December, almost 21 years. So the times have changed so much, where face to face really catching up. We are today sitting where we are and be able to seamlessly connect. Thank you very much. In spite of the New Year celebrations, all the parties, thousands of beer bottles, champagnes, you still joined the class. That clearly shows how much we are determined to become the toppers in NEETPG 2020. Indira, Nagreddy, Haidar, Manjunath, Pramod, Alek, life is good, and many more who are all online. So let us continue our discussion of MCI screening test, foreign medical graduate exam, right? So 2019 December ka question paper, it's worth having a discussion because it is going to be a preamble, a precursor, a paradigm for the upcoming exam in next 4 to 5 days. Very good. Santosh is saying, while our friends are partying, we are studying here. Wow, what a confidence, at least a pseudo reassurance that we are mighty determined to become the topper. Beautiful. Now let us continue our discussion, doctor. What is the most potent opioid? Keep punching the answers. Yes. Most potent opioid. Most potent opioid is fentanyl, carfentanil. It is an analog of the synthetic opioid, fentanyl. It is considered to be the most potent opioid, is what you need to remember. Now, 1 2 comments about each of these opioids. Alfentanil, ultra short acting analgesic. Sufentanil, most potent analgesic, 5 to 10 times more potent than fentanyl, which is used in the heart surgery. Remifentanil, currently the shortest acting opioid and has a great benefit of rapid offset even after prolonged infusion. Carfentanil, it is an analog of fentanyl, and it has got a 10,000 times potency, carfentanil. That is the reason large animals like elephants, to immobilize, they use carfentanil. So fentanyl, sufentanil, alfentanil, they all lead to a truncal rigidity on rapid intravenous administration. In my background there is a lot of music noise of the party. Hope that is not causing a disturbance in the broadcast. Right? Now, once more, FMGE December 2019, allopurinol mechanism of action क्या है? Simplest, easiest question. But let me tell you, doctor, gout is in that golden list of topics, top 50 topics in both medicine and also surgery and also pharmacology. So that is the reason it is the xanthine oxidase inhibitor is what you need to remember. Yeah, some songs background is there. I hope it is not really causing disturbance. I hope so, right? Yeah. Postural hypotension. Commonly which drug lead to? All of you know alpha blocker like prazosin, it has an adverse effect of leading to postural hypotension. One more thing you remember, first dose hypotension, पहले बार जब आप एंटी हाइपरटेंसिव दिए तो हाइपोटेंशन आता. It is typically a feature of even ACE inhibitor. That's what you need to remember. Now, one question comes on diuretics. Diuretics. Once more telling you, doctor, NEETPG, FMGE or any damn exam उनका बाप आए तो भी कुछ भी टेंशन नहीं है क्योंकि examiner has only a fixed box of 953 topics. If you don't have that PDF, please call our helpline 900868 You don't need more than half an hour to revise each topic. That's the reason I always tell 400 to 500 topics is maximum time that we spend on preparation for entrance exam. Remaining time, you have a girlfriend waiting on a candlelit dinner. Please spend with her. If you are already married and have kids, play with them in the moonlight instead of wasting a wonderful life on mugging the facts. Right, doc? Now, Alek is asking strategy for last 4 days. Sleep well, eat well, and silently revise those topics which are in the top 100, right? And the list of things that you made during the preparation. That is the only thing in the last 4 days. Harry Meena, Solanki Saab. In fact, I started the broadcast of this session in order to say Happy New Year to you. First time in 21 years I had been mentoring the PG medical aspirants. I had an opportunity to be live broadcast with being surrounded by all of you. That is a whole euphoria. Ravikant is saying, who said only students sacrifice? Thank you, Ravikant, for a good compliment. But I always thank you, doctor. The only thing I enjoy, the only thing that I know is to spend with the guys who are preparing for the PG medical entrance and the medical students. That's the only thing that gives happiness. Not the gulf, not the money, not the riches, not anything else. The only second thing that gives happiness is to spend time with the patients, talking to patients. Always we cannot treat as a MD general medicine. We cannot cure. Sometimes we can palliate. We can alleviate their pain. That's the only thing that brings happiness. So carbonic anhydrase inhibitor is acetazolamide, which is most cardiotoxic anti-cancer drug. Maran is asking, sir, I wonder how you are enthusiastic every year with students, because it is like a phenomenon of transference. I always, when I come to class in a live broadcast, I will think that I'm your classmate, I'm your junior in fact, who is trying to help my senior Anna to prepare for the exam. That is the kind of a feeling that I have, that I will always have, right? So those topics, if I can help a little bit, I can add a little brick to my brother's building of a castle. Wow, what a feeling when he becomes a topper. That is the feeling I always carry with me whenever I come to a class. Right? Now, the most cardiotoxic drug is anthracyclines. In fact, doxorubicin, daunorubicin, they all lead to development of cardiotoxicity. In fact, just 5 days back only, I had Venkat Lakshmi was my patient's name. In fact, she was my schoolmate's mother. She had a breast cancer, and for breast cancer, she was treated with Erythromycin about 10 years back. Now she has dyspnea, etc. The cardiologist has in fact referred to me saying that please evaluate for a possibility of the cancer associated complication of the dilated cardiomyopathy. But luckily, after we have thoroughly evaluated, she is not looking to be, the underlying cause doesn't look to be so. But she definitely has dyspnea while lying down, Niha, class 3, right? So this anthracyclines, I can never forget, at least she was the 6th patient I have seen who had cardiomyopathy induced by the daunorubicin after being treated for malignancy. Now, doctor, so doctor, chemoprophylaxis of choice in a person who is on a journey to endemic malaria. Morning only we discussed. It is the chloroquine that we administer. So the chloroquine, doxycycline, mefloquine, etomoquone and proguanil. These are the classical drugs which are used in the malaria chemoprophylaxis. So always the rule is short-term prophylaxis के लिए doxycycline, long-term prophylaxis के लिए mefloquine. In the malaria prophylaxis, you should not forget. Once more, on the online mbbs.com video library, we have an extensive discussion on the anti-malarial drugs in pharmacology. There is a folder called 30,000 hot MCQs discussion in online mbbs.com. Please take a chance to review, doctor. अभी आ गया, मैंने बोला ना, इसके पहले भी बोला ना, बहुत बार बोला ना, migraine, without a question on migraine, cluster headache, tension headache, there is no examiner. So, doctor, if there is a male patient with headache, what is the possibility? Without looking anywhere, you jump and think of cluster headache. Typically, cluster headache patients will have. How do they tell you the history? Oh, doctor, something is tearing my flesh out of my eye. He'll be having lacrimation, periorbital sweating, etc., etc. All autonomic nervous system features, male patient. Migraine is typically female. So definitely one question come on one of the types of headache, doctor, be very sure about it. Prophylaxis of migraine we use propranolol, amitriptyline, flunarizine. Come on, who will use flutamide? Very easy question, right? So what is flutamide? But before that, what are the drugs used for prophylaxis of migraine, doctor? Propranolol, nadolol, amitriptyline, nortriptyline like tricyclics, divalproex sodium like anticonvulsant, calcium channel blocker like verapamil. They are all the ones which are basically used. So, what is the guideline for the migraine prophylaxis? At least 1 year you should continue prophylaxis. Preventive therapy needs to be taken every day because it requires a dosage titration. Therapy from 6 to 12 months is required before you decide on whether this is efficacious or not. Just similar to the NEETPG preparation. 6 to 12 months is required before you decide on whether this is efficacious or not. Just similar to the NEETPG preparation. 6 to 12 months is required before you decide on whether this is efficacious or not. 6 to 12 months is required before you decide on whether this is efficacious or not. Just similar to the NEETPG preparation. You spend 6 to 12 months with Dr. Murali Bharadwaj. अगर सीट नहीं आए तो मेरा जिम्मेदारी, मैं बोल रहा हूँ, ठीक है? So a full therapeutic trial will take about 2 to 6 months of time, similar to NEETPG preparation, and not more than that. Now, doctor, flutamide. What is flutamide? Flutamide is an anti-androgen, and typically one of the drug reaction obviously for anti-androgen is, if you are suppressing androgen, you are promoting estrogen. That's the reason gynecomastia, breast tenderness, they are the side effects. A farmer with pinpoint pupil with increased secretions. Favorite MCQ of examiner. FMGE MCI screening test December 2019 या 2059. If I am alive, invariably one question will come on OP poisoning, Dabigatran poisoning, opioid poisoning, atropine poisoning, because day in and day out clinical practice में every day we see OP poisoning. So why in OP poisoning? Organophosphate is an inhibitor of acetylcholine esterase. That is the reason acetylcholine levels will increase, and that will lead to excess acetylcholine, lead to all secretions. All secretions. Patient will be having excessive salivation. He will be wetting the lungi that he is wearing, right? Because acetylcholine contracts the detrusor, and that lead to urination, everything. And what is an important rule in OP poisoning? You will give atropine to treat excess acetylcholine. But before giving atropine only, you should do catheterization. If you don't do, what will happen? If you have given atropine, you have not yet catheterized, what will happen? Typically, this is the bladder, doctor. You have the sphincter, urethra. So this atropine will make urethra will go into spasm. I mean, the sphincter becomes spasmodic. And after giving atropine, if you try to put Foley, it is difficult to negotiate. That is what you need to remember. Whatever, happy to see 70 online students. Ramavatar Sharma, Joshi, Chalapati, Maran, Indira, everybody. So, doctor, please drop a line in your WhatsApp, Telegram, Facebook classmates to join the session. Now, therapeutic drug monitoring, where do you want to do? We want to do in case of phenytoin. So what is the normal phenytoin therapeutic range, doctor? Definitely examiner is going to ask. Digoxin, lithium, phenytoin, phenobarbital. You should be sure on the therapeutic levels. 10 to 20 micrograms per milliliter. Why do you want to monitor the phenytoin? Because it has a narrow therapeutic window. That is between its toxic effects and therapeutic effects, there is a very narrow gap. Then it is highly protein bound, lot of drug interactions, non-linear pharmacokinetics, inter-individual variability. Ramu and his brother Bhimu will have a different response to the phenytoin. That's the reason. And typically you will monitor the phenytoin, those guys, of course phenytoin today is almost an outdated drug except in a status, because there are much better drugs today in the modern anti-epileptic management of the patients. You don't need to give the patient that hirsutism, gingival hyperplasia, you don't need, right? But still, if phenytoin is being taken, you need to monitor it 3 to 12 months intervals. Now doctor, what is the oral direct thrombin inhibitor? मैं और एक बार बोल रहा हूँ डॉक्टर, आपको 953 टॉपिक्स दिया ना, definitely one question will come on antiplatelets, heparin and anti-thrombotic agents. Without that there is no paper. aspirin, clopidogrel, ticlopidine, heparin, low molecular weight, complications. Then what are the direct thrombin inhibitors, which are oral, which are intravenous? Everything padna chahiye, doctor. So you have 1100 MCQs of the past 15 years of All India Pharmacology, All India PG Medical and NEETPG का last 15 years 1100 MCQs 50 topics हमने discuss करके online MBBS में बिठाया. So please take an opportunity. There is about 35 hours of discussion. Please take a chance to review it. So it is a oral direct thrombin inhibitor, doctor. Dabigatran is what you need to remember. So you have bivalirudin, lepirudin, argatroban, dabigatran. What are the main differences between them? Once more नीट पीजी में यही टॉपिक के ऊपर क्वेश्चन आएगा. आप मॉनिटर को देखते हुए हंसेगा. अरे 31st को मुरली भरद्वाज के साथ यही डिस्कशन हुआ बोल के फट यू विल किल द आंसर, राइट? दैट शुड बी द स्पिरिट इन द टुमारोज एग्जाम. Alek is asking, is FMGE easy, sir? Very difficult question पूछते हो Alek. It is like asking, is it easy to handle a girlfriend? It all depends on you, how good you are a boyfriend, how kind you are and how considerate you are, how sensitive you are. There are so many factors. How much you prepared will decide. So doctor, bivalent is bivalirudin, lepirudin is bivalent, argatroban is univalent, also dabigatran. But bivalirudin, lepirudin, argatroban, they are all parenteral, not oral. Whereas dabigatran is basically oral, is what you need to remember. Umakant is asking, sir, this time FMGE paper appears to be little easy. कल के NEETPG भी ऐसे ही रहता, जरा इधर उधर, ठीक है ना डॉक्टर? Why? Because one simple rule you will remember. Almost 2 lakh students take this NEETPG exam across the country. Kali मैं और तुम kali नहीं. So that is the reason examiner cannot be too creative. He need to be standard. Standard question paper is the only option available for him. Only your preparation need to be little standard. Right, doc? So, clearance. See, if it is a NIMHANS entrance or PGI or JIPMA, they have a luxury to be little out of the box and create questions. But it is an all India postgraduate medical entrance. Examiner has no luxury of that. Have you seen the serial crown, Queen Elizabeth? Queen Elizabeth, however innovative, she cannot be out of the box. She cannot be out of the box. She cannot give a statement also. All India postgraduate medical entrance is also like the Queen of England, crown. That is what you need to basically remember. इसलिए मैं क्या बोल रहा हूँ? To crack the crown is very easy job. If you have prepared for 953 topics, 20 points on 953 topics, around 20,000 points, आपके tips में रहना. That is the most important thing for you to win. Be very sure. So bivalirudin is enzymatic. Lepirudin is kidney eliminated. Argatroban is liver eliminated. Dabigatran is once more kidney eliminated. So I leave the literature for you. इसके पहले भी बहुत बार इसके बारे में डिस्कस किया हमने. Which drug follows zero order kinetics? Once more. Zero order, first order. Zero order, first order. Favorite question of the examiner. Phenytoin. Even aspirin is also zero order, but it is at a high dose. High dose only. It is zero order. But in any dose, phenytoin is zero order. A lady has taken medication for amoebiasis. She developed nausea, vomiting, giddiness. Typically, disulfiram reaction is because of which drug interaction with alcohol? Metronidazole. Now, doctor, favorite question of the examiner. What are all the drugs that lead to disulfiram? What is the mnemonic? Divya Prakash Solanki Saab. You have to join online mbbs.com video library. If you join this video के साथ ये जो PowerPoint में डिस्कस कर रहा हूँ ना वो भी अवेलेबल रहता है. वैसा आपको 2 lakh PowerPoint slides are available. 3,000 video lectures are available on the online mbbs.com. So please join. Pay whatever that you can. It is not compulsory that we are not a costly resource. Why? Because I only teach everything. 10,000 students join or 1,000 students join, एक ही होता है मेरे लिए. That's the reason we don't have price unlike many corporate tutorials. There multiple teachers need to be employed, they need to be paid. Of late I am hearing that they pay almost 10,000 rupees per hour of lecture to the teacher. Obviously they will put all that burden once more on the students. They have no choice to be democratic. I have a choice to be democratic. If a student want to pay 1 rupee also, we will give subscription. If a student pays 50,000 rupees also, we give subscription. That is a great advantage. So please subscribe to this channel. Sorry, Pluto can't go to Mars. Obviously now. Sulfonyl ureas, first generation wale, chloropropamide can lead to disulfiram. Procarbazine among anti-cancer drugs, cephalosporins, sifotidone, cifoperazone, they lead to disulfiram. Grisophilvin, disulfiram. Metronidazole, disulfiram. You are not going to forget this very important mnemonic for the disulfiram reaction. Once more, डॉक्टर, मैं इसके बाद पहले भी बोला, अभी भी बोल रहा हूँ, कल भी बोलूँगा. Theophylline and its drug interactions. Last 15 years में 100 times examiner यही question पूछा है. So if you go to exam without knowing the theophylline drug interactions, we are gone, right? So very good to see. Shweta bete. So, as every day I keep meeting you, doctor, you become part of my life as much I become part of your life. So, हम दोनों मिलके ये जंग जीतना चाहिए. So that is what is the purpose of any mentor and a student. It is like the warrior called Arjun, chariot called Krishna, together will win the war. That is the deal. So, doctor, anti-asthma drug. Theophylline has interaction with erythromycin. इस लिस्ट को भूलना नहीं डॉक्टर. फेवरेट क्वेश्चन ऑफ द एग्जामिनर. कल के नीट पीजी में भी पूछेगा. Smoking, high protein, low carbohydrate, barbecued meat, childhood, P450 inducers, they all increase the clearance. Like rifampicin, phenobarbital, carbamazepine, ethanol, alcohol, decrease the clearance, CHF, liver disease, pneumonia, viral infection, vaccination, high carbohydrate diet, old age, etc., etc. Now, doctor, a patient after valve replacement, what he need to receive? Warfarin as an anticoagulant. So, how do you anticoagulate a patient with a prosthetic valve? Aspirin, warfarin, and the goal is between 2.5 to 3.5 if it is a mitral valve or aortic valve replacement with other risk factors. What is the antidote for opioid poisoning, doctor? We give naloxone, whereas flumazenil is for benzodiazepine toxicity, like diazepam, flumazenil. Opioids के लिए naloxone. That's what you need to remember. So, Naloxone is the one which is used for narcotic overdose. Monoclonal antibody which is used in cancer. मैं इसके पहले भी बोला अध्यक्ष महोदय, आज भी बोल रहा हूं, कल भी बोलूंगा. क्या बोलूंगा? विदाउट ए क्वेश्चन ऑन मोनोक्लोनल एंटीबॉडी हमारा जंग खत्म नहीं होगा नीट पीजी में. There are a list of 15 monoclonal antibodies commonly asked in the NEET PG exam. I already gave you that list. It is available in the onlinembbs.com. Please do the revision. It is the rituximab, Rituxan. So basically there is a complement mediated cytotoxicity and CD20. This rituximab is a monoclonal antibody that blocks the CD20 is what you need to remember. So where do you use rituximab, doctor? Very good. 84. Please tell your classmates to join. An opportunity to enter into 2020, the timeline of the God, with all the friends and classmates across the country. Right, doc. Non-Hodgkin's lymphoma, CLL में rituximab, rheumatoid arthritis, vaginal granulomatosis, ITP, pemphigus vulgaris, myasthenia gravis, Epstein-Barr virus, mucocutaneous ulcers. In all that, rituximab is used. Right? Now, doctor, find out the therapeutic index. Examiner asked. भैया therapeutic index क्या होता है? Lethal dose divided by therapeutic dose. TD50 by LD50. Sorry, LD50 by ED50. So ये lethal dose कितना है? इस पेशेंट में 400. Therapeutic dose is 100. So 400 by 100 is equal to 4. That is what examiner is asking. Once more, doctor, अभी भी मैं आपको याद दे रहा हूँ. Volume of distribution, clearance, loading dose, maintenance dose. ये पूरा फार्माकोकाइनेटिक्स रहता है. 100% श्योर होना कल के एग्जाम के लिए. So that is the reason. Please go back to the onlinembbs.com video library. Without this, there is no entrance exam. Zero order kinetics, first order kinetics, VED, clearance, all these concepts. You have to brush it up very, very clearly. Bhargava is saying, Happy New Year from Kyrgyzstan. Very good. Bhargava, Kyrgyzstan में अभी टाइम कितना हुआ बेटा? Bhargava. So remember, doctor, you guys who are preparing for NEET PG, you cracked one of the toughest undergraduate MBBS entrance exam. So that is the reason you need to remember that wonderful willpower you used to have about 5 years back. If anybody says, you may not get seat, will you leave him? You will kill him. Same spirit abhi bhi rehna chahiye. That is most important. And we have friends all the way from Kyrgyzstan, Moscow, Beijing and Philippines and Caribbean Islands. Pradeep Kumar is one of our students from Caribbean Islands. इतना दूर जाके बहुत मेहनत करके पढ़ाई करते, right? So that is the reason, doctor, whatever be your background, forget yesterday. Yesterday you cannot bring it back. Another few minutes we cannot bring back 2019. Only we will tell to our grandchildren that story of 2019. We should only live today this moment and tomorrow, a hope for tomorrow. That's the only thing. So that's the reason, no regrets, no tension, no anxiety, enjoy. If you are born to get that seat, nobody can take it away, right? And if you have not prepared, you could not make it up, no one can help you to get it. So that is the reason you have to be very, very sure. So doctor, gynecomastia, liver failure, spironolactone, digoxin, they all lead to gynecomastia. How about aromatase inhibitors? भैया, first of all, what are aromatase inhibitors? उसके बारे में बात करो. Aminoglutamide is called first generation. Exemestane, anastrozole, letrozole, they're all third generation. So you should remember that aromatase inhibitors will decrease the production of estrogen. In fact, they will help you from developing gynecomastia. 34 weeks pregnant lady, having seizures, BP 200 by 110, eclampsia. You call preeclampsia without seizures, eclampsia with seizures. That's the reason you want to give IV labetalol plus max sulfate. How does hydrochlorothiazide work? It looks to be a very easy question. You answer, I will check how easy it is. Question number 105, push your answers. Quickly push your answers. 105. Another 4 students, हम century मारेंगे on this midnight of 2019. Another 50 years this video will remain on the YouTube and you will have a story to tell your grandchildren. Right? Come on. Sunil Yadav says early DCT, Shipra. Come on, Shipras. Sodium potassium 2 chloride कहाँ रहता बेटा? Furosemide, loop diuretics. Nag Reddy साहब, आप don't break my heart. Nag Reddy साहब, आप wrong नहीं कर सकते. पूरा district is looking at Nag Reddy ji that he will become the topper in the service quota. Shivam Sharma is saying early DCT. Excellent. देखा ना, हम सबको मालूम है ये डिस्टल कन्वल्जेंट ट्यूब्यूल की मामला है. But early and late DCT में जरा confusion हो जाता. नहीं हो ना? Exam बोले तो नहीं हो ना? Hydrochlorothiazide, metazoline, chlorothalidone, they are all thiazide diuretics. It inhibits sodium chloride symporter in distal convoluted tubule. Loop diuretics lose calcium. Thiazide diuretics retain calcium. They increase calcium, decrease magnesium, decrease potassium, decrease sodium, but calcium, they retain calcium. So, bhaiya, thiazide is early distal convoluted tubule. Loop diuretics are on sodium potassium 2 chloride in the ascending loop of Henle. Potassium sparing diuretics, which are aldosterone receptor antagonists, they act on the late distal convoluted tubule is what you need to remember. Now, what is the drug of choice for hyperthyroidism in the 3rd trimester of pregnancy? It is carbimazole, propylthiouracil, 1st trimester, methimazole, 2nd, 3rd trimester, and contraindication. Iodine, we should not use in pregnancy. If the lady is hypothyroid, you can give levothyroxine 0.1 mg per day. These are all the points that you need to remember. Once more, with regard to the earlier question, once more I am telling you, doctor, 953 topics, pharmacology के top 10 topics in the descending order. I have given you 50 topics in pharmacology in the descending order of priority. Top 10 में होता है diuretics. आप देख लिया ना? Without diuretics, there is no NEETPG, no AIMS, no PGI, no FMGE. Be very sure. Now, doctor, what is the mechanism of action of exenatide in diabetes? One more Nostradamus prediction. Insulin, oral hypoglycemic agents. Without that, there is no paper. Because pharmacology में 50 topics में जो दिया ना, top 10 में आता है. Insulin, oral hypoglycemics. If you did not revise it, you are losing it. You only take half an hour to become expert in insulin and oral hypoglycemics. That is the point. Come on, shoot your answer, doctor. So, Alexei says, can you please say top 10 for pharma? Come on, Alex. You already have the list. हम एक साल से दोस्त हैं, दोस्ती, right? So, you know that very well. So please share that 953 topic PDF of the high yield topic list, every subject in 19 subjects में, top 15 descending order, please share it with everybody. So everyone is saying A. So it is the analog of GLP, which is released from the gut and increase the glucose dependent insulin secretion. So doctor, खाना खाने के बाद there is a glucagon like peptide 1 which is produced that will go to the insulin, pancreas, and make it to release the insulin. So any GLP-1 analog will emulate like GLP-1 and make insulin secretion. Albiglutide, dulaglutide, exenatide, liraglutide, they're all GLP-1 analogs. But this GLP-1 is being broken down by this DPP-4, which metabolizes the GLP-1, inactivates it. We don't want that inactivation. So you give a DPP-4 inhibitor. So what are they? Allogliptin, sitagliptin, saxagliptin, linagliptin. They're all the DPP-4 inhibitors. Now doctor, the least teratogenic anti-epileptic drug in pregnancy. We are still having 11 minutes before 12 p.m. We have 94 online. So, I'm just taking a screenshot. So, I just want another 6 of your classmates. Below. Hum 100. Like a Rohit Sharma making a century, we should enter into 2020. Levetiracetam is the least teratogenic. Once more. Anti-epileptic drugs in the top 20 topics. You should not do mistake. Definitely aayega question. So, levetiracetam monotherapy in the pregnancy has the least teratogenic effect is what you need to remember. Now doctor, gliadin, it is there in which food? Rye, barley, wheat. In celiac disease, it is not good. Whereas quinoa is a nutrient-rich seed that does not contain gluten and can be given as an alternative to the patients who have celiac disease is what you should remember. So celiac disease का main management क्या होता है doctor? You have to give vitamin D, vitamin B12, folate, iron deficiency is common, you need to take care. Copper, zinc, carnitine. Wheat, rye, barley contain gluten. Oats are considered to be safe. But sometimes oats में adulteration होता है. So, if you give gluten-free diet, even biopsy become negative. Now, doctor, flightennular conjunctivitis. Some of you are there in that class one Sunday, morning 9 a.m. to evening 5 p.m. Non-stop we have discussed 300 MCQs in ophthalmology. last 15 years of foreign medical graduate exams and MCI screening test. I have given you the list of top 20 topics in pharmacology, sure shot aane wale, in the descending order of priority. Flight tennular conjunctivitis is one of them. So typically it is considered to be a hypersensitivity to the tuberculous antigen is what you need to remember. So classically there is no clear zone between limbus and the lesion. So it manifests like a raised small pinkish white or yellow nodule surrounded by the dilated vessels is what you need to remember. A researcher wants to do a survey for vitamin A deficiency in school going children. What he should look for? Bite hot spots. Morning also we have discussed this question. So what are bite hot, doctor? Triangular pearly white or yellowish foamy spots on the bulbar conjunctiva on either side of the cornea, usually bilateral, typically seen in vitamin A deficiency. Keratometry, what is it used for? It is used to look for the curvature of the cornea. Whenever there is any astigmatism, we use the keratometry is what you need to remember. हम बहुत खुश हो गया on this wonderful eve of 2019 December farewell. In another 7 minutes, we have 101 online classmates. Badhiya. Yeah, Pranati is saying morning you said night blindness. No sir. Actually night blindness and bite hot, there is a little chercha, little controversial, but I still prefer bite hots. Bite hots is more likely to be the correct answer. Now, Flischker ring, where do you see, doctor? Once more, keratoconus is a favorite question. Everything about it. Keratoconus is typically, there is a ring which is partial or complete annular line commonly seen. Suppose if this is the cone, keratoconus, the base you will find this Flischker ring which is containing the hemosiderin pigment is what you need to remember. At the base of the cone, you are able to see now the Flischker ring in keratoconus. A patient came to you with the complaint of pain, redness, decrease in vision since one day, and you are able to see that his pupil is mid-dilated. That is a sign of angle closure glaucoma. So you have a red eye, hazy and edematous cornea, semi-dilated pupil. That is what you see in case of angle closure glaucoma. Now doctor, contact lens versus spectacles. Chashma, what is the difference? If you use a bada chashma, peripheral aberrations will be there. That will not be there with a contact lens. What does this image suggest, doctor? Very standard question. Dendritic ulcer. So dendritic ulcer is a classic herpetic lesion. The borders are slightly raised greyish. They stain with the rose bengal. They contain infected cells that have undergone acantholysis. It is a dendrite-shaped scar called ghost dendrite, and it remains in the superficial stroma is what you need to remember. Once more, doctor, what is the top 20 topic list in ophthalmology? Definitely herpes ka involvement of the eye is the favorite topic, doctor. Now, this image where the retina become bloody, completely bloody, what is that? Central retinal vein occlusion. Once more, मैंने क्या बोला आपको? Cravo. CRVO. Without a question on that, examiner chhodega nahi. Out of the 10 questions that he is going to ask in ophthalmology, in tomorrow's NEETPG also same story. Cravo mein hota hai cherry red spot. CRVO mein this kind of a thunder will be all blood-studded retina is what you typically tomato splash appearance bolte hain isko. You have to be very sure about. Now, doctor, what is the pathology? What is the pathology which is being shown here? So, you should remember, it is a keratoconus. Social blindness, how do you define it? It is a vision which is less than 3/60. Vision 3/60 or diminution of the field of vision to 10 degrees, social blindness. Manifest blindness, vision 1/60 to just perception of light is manifest. Absolute blindness, no perception of the light is called typically the social blindness is what you need to remember. So now, doctor, hordeolum internum. Yes. Hordeolum internum. What is it? So typically it is the involvement of meibomian gland. Please don't forget, doctor. Internal hordeolum जो होता है, Staphylococcus abscess of the meibomian gland is a tender surface in the tarsal and main, and they discharge to the skin or conjunctiva. External hordeolum को बोलते हैं style. Recently, while discussing ophthalmology only, I had a style. I was wondering how is my sugar levels. Fasting blood sugar 90. Why 90? Because I am spending with about 100 doctors every day, exercising, preparing like a young NEETPG aspirant instead of being just a consultant. Obviously, sugar should be 90 only fasting, right? So, stye can occur because of many reasons. One of it is you should always check for diabetes. So, that is the story, doctor. Now, the countdown begins for the year 2020. Come on, doctor. Excellent. So, the whole euphoria of 2019 is over. Khatam. Right? Thank you guys for giving your time, spending your time with Dr. Murali Bharadwaj, because there is nothing more happier than to be with all of you on this auspicious evening. Auspicious evening, doctor, and let me tell you, lot of your family, friends, everyone is pouring a lot of greetings. But you have chosen to spend with all your classmates across the country who are preparing for the NEETPG. Please be part of our WhatsApp study group. So all the guys who are joining, with whom you are spending this 2019, the last year where you are only MBBS, you are going to become 2020 May MD, MS is what you are going to become. 10 more questions we will discuss before we. Kabhi alvida na kehna, kabhi alvida na kehna. So before we say alvida, 10 more questions. So Dr. Pankaj is saying, sir, I am FMGE, sir. Very good. So 15-year-old boy having sore throat with swelling posterior to the posterior tonsillar pillar. Tonsils are normal in size. Very happy new year to all of you guys. May God give you all the courage to emerge as the most powerful PG aspirant and prove the world. हम कामयाब होके दिखाएंगे. Beautiful positive sentence. I always remember. Very good, Alek. Now, parapharyngeal abscess. One important point you should remember. In peritonsillar abscess, uvula is shifted to the opposite side and the soft palate appears full. And the tonsils will be, in case of parapharyngeal abscess, tonsils will be normal in size and position. But there is a swelling posterior to posterior tonsillar pillar. Retropharyngeal abscess, the swelling is in the midline. And if it is from the vertebral body, commonly the source is TB spine. And that is what you need to remember. Always if there is a trismus, it means to say there is a parapharyngeal abscess is what you need to remember. Office headache. Which sinus, doctor? It is frontal sinus. You should remember early morning headache on waking up and again at the end of the day. सुबह सुबह उठते ही सर में दर्द और end of the day. What type of sinusitis? Maxillary sinusitis. Diurnal variation. Office headache is frontal sinusitis. Patient wakes up mostly without pain because of the overnight there is a drainage. Night jo so gaya, drainage ho gaya. And he develops pain after few hours when he is entering the office and it lasts throughout the day. That is, office headache is frontal sinusitis. Vacuum headache, headache on waking up, that may occur in frontal sinusitis due to overnight drainage that creates vacuum. So that is the reason even frontal sinusitis can lead to headache on waking up is what you need to remember. Malignant otitis externa is because of pseudomonas. In early diabetics, immunocompromised, you have the pseudomonas aeruginosa associated necrotizing otitis externa. Meniere's disease, it is an endolymphatic abnormality, idiopathic cause, ablation. Ablation is considered to be the treatment, right, doc? It is a low frequency hearing loss, doctor. Low frequency hearing loss, please remember. Not high frequency. So Meniere's disease is an idiopathic endolymphatic hydrops, spontaneous episodic attacks of vertigo. Thank you, Nagredi. In fact, I told in the party, all three large single malt scotch, not now. I'm going to toast one peg of scotch in order to say to my friends, and there's a big group, bunch of friends in the downstairs. I said, I'll finish the class, I come. Guys, wait for me, then we will start the party. And we will party hard until morning 5 o'clock. So they're all waiting, no problem. So 10 more questions, I'm done, right? So, I'm telling you, doctor, without even passing MBBS final year, I married my childhood sweetheart, running away on a bike and married against the whole society. But the same person always supported me. People challenged that you won't even pass MBBS because how will you be able to live sustaining a marriage with a girl? So she has, my sweetheart has seen me preparing for MBBS final year exam, internship, and then getting into post-graduation. Lots of ups, downs in the last 23 years. So I want to once more tell you all guys that Don't postpone your marriage. Don't postpone your spending with friends just because you have some stupid mission called exam. Exam hai, romance hai, and spending with family is itself. They both are two separate things. So you enjoy the both. Then only you are a complete human being, right? So if you are doing internship, there's no point in skipping the opportunity to do a pigtail catheter, intercostal drainage tube, intubation, lumbar puncture, just because you want to go to reading room. No point. Because once more that opportunity doesn't come, that age doesn't come, so be very sure about it. So 10 more questions, doctor, we will call it a day. So what are all the causes of the low frequency hearing loss? Wolfram syndrome, Meniere's disease, fistulas, cochlear malformation, renal failure, viral infections, low frequency. High frequency hearing loss agar hai to, what will be the problem? You will struggle to understand the high pitched voices like the women, children, their voices samajh mein nahi aata. Bibi kya bol rahe hai samajh mein nahi aayega. You have stopped hearing the birds chirping. The words that start with S, H, F, they are very difficult to be heard. Yes, H, F, all bad words start with them only. So when people talk, you feel that you can't hear, you can hear but you cannot understand. High frequency loss. So if you look at the sensory neural hearing loss in Meniere's disease, fluctuating, progressive, the peak usually classically at 2 kilohertz. There is a tent-like audiogram, and that is a classical feature of Meniere's. Similarly, tinnitus of Meniere's is non-pulsatile. It will be described as a whistling, roaring one, is what you need to remember. Now, doctor, how do you treat Meniere? Ototoxic ablation, transtympanic injection of antibiotics that are toxic to the inner ear, endolymphatic decompression, labyrinthectomy, they are all the options. Epstein-Barr virus is associated with what? Nasopharyngeal carcinoma, Burkitt's lymphoma, infectious mononucleosis. Very routine MCQ. Similarly, lymphoproliferative disorders in immunocompromised are due to Epstein-Barr virus. Chronic infectious mononucleosis, oral leukoplakia in case of AIDS patients. Chronic interstitial pneumonitis in AIDS patients. They are all the ones Epstein-Barr virus associated. How do you treat nasopharyngeal cancer? Once more, ENT mein what are the top 20 topics? Larynx cancer and nasopharyngeal cancer. Half an hour is enough to master 20 points about this, each topic. But we keep on postponing. That's why we lose the opportunity, doctor. So that's the reason, no worries. Now, it is the radiotherapy. External beam radiotherapy is the primary mode of management of the nasopharyngeal carcinoma, is what you need to remember. Chemotherapy, it can be delivered before, during or after the radiotherapy. That is also another option. What is the most common presentation of nasopharyngeal carcinoma? देखो भैया, कितना favorite area है examiner के लिए, whether it is FMGE or NEETPG or AIMS, king is nasopharyngeal carcinoma. You want to be sure. It is the enlargement of the lymph nodes in the neck. Asymptomatic cervical lymphadenopathy is the classical feature in case of nasopharyngeal carcinoma. And most commonly, it is the upper posterior deep cervical lymph nodes, which are the ones which are involved. Epistaxis is found in 73%. Unilateral serous otitis media. And always a very important principle. If the patient is having multiple cranial nerve palsies, you should always suspect the possibility of nasopharyngeal carcinoma, because whenever our nasopharynx is involved, all the foramen spinosum, jugular foramen, all these foramens in the calvarium, they become studded with this malignancy. and that lead to multiple cranial nerve palsies is what you need to remember. What is diagnostic of CSF rhinorrhea? Beta-2 transferrin, CT cysternography, nasal endoscopy, etc. etc. So we do glucose testing, CSF glucose is low, beta-2 transferrin assay, we do diagnostic nasal endoscopy to localize the leak of the CSF. Then we also use beta trace protein, which is specific for CSF. Absolutely, Alec rightly says, elderly with serous otitis media should always be suspected nasopharyngeal carcinoma. Now in a high resolution CT, you are able to see the typical bone cuts and axial cuts. CT cysternograph, intrathecal injection of iohexol, CT scan, it can be able to localize the site of leakage. Similarly, MRI, the T2 weighted image can be able to identify where is that white leaking is what you should remember. Where is that white leaking? Always T2 weighted images में क्या होता है doctor? CSF looks white. T1 weighted में CSF looks black. Intrathecal fluorescence study is another way. Now doctor, double decidual sign in ultrasound. Where do you see? Intrauterine pregnancy. So doctor, if you want to differentiate a early intrauterine pregnancy from a pseudo-sac of the ectopic pregnancy, we use double decidual sign. So here you see a gestational sac like a echogenic ring which is being formed by a decidua capsularis and the chorion livae along with decidua vera. So two, one fetal, one maternal. Both the things contribute double decidual sign. So double decidual sign is the earliest finding, typically seen around 4.5 to 5 weeks. Initially eccentric in location, it will be able to differentiate the pseudo-gestational sac, which is typically seen in the case of ectopic. So this is once more, decidua basalis, decidua parietalis. So double decidual sign, and this is decidua capsularis, which is suggestive that yes, by a intrauterine pregnancy बोल के आप दावे से बोल सकते. Decidua parietalis, this one. This is uterine cavity. This is decidua capsularis, this one, and this is the decidua basalis, and this is the gestational sac. That is what you need to remember. Now doctor, a lady met an accident with a helmet in her head. She comes back with a running nose. What is it? CSF rhinorrhea. Largest ethmoidal air cell. Come on. Punch your answer, doctor. Who is going to give me the correct answer? Largest ethmoidal air cell. Who is going to give me the correct answer? वर्मा जी बोल रहे हैं बुल्ला, उमाकांत also, Gagan Kuber, the top guy in biostatistics, cannot go wrong. Jagadishwari, A. Eira, A. Arey, Guru Prasad, A. No, clean ball, clean ball, clean ball. Pankaj rightly says, right? Ethmoid bulla. So I say questions ko doctor, be very careful while answering. There is always a temptation to answer. You know undicel, you know agar na say, you know, you heard of ethmoid bulla. So there is a temptation to answer. 1/4 negative mark, Gaya. Right? So ethmoid bulla is the largest anterior ethmoidal air cell. It is the most consistent air cell in the middle meatus, hence it acts like a anatomical landmark. So these are called Haller cells. Haller cells. Haller cells are the ethmoidal cells that pneumatize inferiorly to the orbits. Orbit है ना? Inferior to that. Towards the interior of the maxillary sinus. And in special situations, these cells may reduce the osteomeatal unit and they can predispose to the obstruction of the maxillary infundibulum. That is the reason you need to remember Haller cells is what you need to remember. So doctor, this is ethmoidal bulla. Ethmoidal bulla. Ethmoidal bulla. सबसे बड़ा एज स्पेस. इसका आंसर जवाब दे दो डॉक्टर. कौन बोला एफएमजीई इजी एग्जाम है? एफएमजीई में ट्रिकी प्रैक्टिकल क्वेश्चंस पूछता है. लेट मी चेक हु विल गिव मी द करेक्ट आंसर. कम ऑन. रॉन्ग आंसर के लिए 1/4 नहीं, 1 फुल मार्क नेगेटिव मार्क. अभिषेक जी बोल रहा है अमीबियासिस. इंदिरा जी बोल रहे कलरा. मारन इज सेइंग कलरा. गगन कुबेर हमारा प्रोफेसर बायोस्टैटिस्टिक्स कांट गो रॉन्ग. कोपुला सेज कलरा. कम ऑन. Tech again is saying Kalla. Jagadishwari is saying giardiasis. अम्मा. और क्या है? फटाफट बोलो. इतना न्यू ईयर डे पार्टी को भी छोड़ के मुरली भारद्वाज के साथ अगर आप स्पेंड कर रहे तो टाइम में जरा आपको वैल्यू एडिशन देना पड़ता. Come on, doctor. Come on. Any other answers? Ajay Maurya is saying amoebiasis. Any other answers? Punch. Salina Ambar is saying ये कल के नीट पीजी में यही क्वेश्चन आएगा, मुझे लड्डू भी देना. सर सब पढ़ के भी ऐसे क्वेश्चन में फंस जाते हैं. अरे वाह, दैट्स राइट. फसक बोलते. आईरा हैप्पी न्यू ईयर. बैक्टीरियल डिसेंट्री. Give a loud clap to Nagreddy and Aira. Great, doctor. This is the last question for 2019. Shock there now, man. I didn't know this answer, but for preparing for this session, amoebic dysentery versus bacillary dysentery का क्या फर्क है देख लो, right? मजा आया ना? 6 to 8 motions only generally amoebic dysentery, or 10 motions a day bacillary. Copious is amoebic. Bacillary is only small amount. Blood mucus semi-formed, amoebic dysentery. Blood mucus mainly watery is bacillary dysentery. Fishy smell, odor offensive होता है amoebic dysentery. Odorless is bacillary dysentery. Oh my God. मिल गया ना? शॉक मिल गया क्या या नहीं मिला? That's the beautiness. So doctor, with this question we are going to sign out. Amoebic dysentery is dark red, altered blood. Bright red, fresh blood is bacillary. Acidic is amoebic dysentery. Alkaline is bacillary dysentery. Not adherent to the container is amoebic dysentery. Adherent to the container is bacillary dysentery. Clumps of RBCs in amoebic dysentery. I'm not going to read this table for you. I'm going to leave this PPT for you in the onlinembbs.com, doctor. Enjoy the party. The night is young. You can hard party until the morning, right? So we will once more meet tomorrow, doctor. My plan is January 1st, 2nd, 3rd, 4th. 4 days time है हमको, बराबर? So a 4 days में हम my plan is 2019 का December June, 2018 का December June. So totally 1200 MCQs of foreign medical graduate exam. फटाफट revision करेंगे. And we will go with the head held high to the NEETPG tomorrow. Thank you very much. God bless you all. You're all hardworking guys and great guys. Cream of the country. Next 50 years, you're going to treat masses of patients with those wonderful hands. Just one small step to clear this NEETPG exam. Good night, and we will all catch up tomorrow. Thank you.